Well, the first limitation is the referral and the low uptake to pulmonary rehabilitation programs, and this is a global major concern, as we know from the evidence that the majority of patients who participate in pulmonary rehabilitation programs, they actually benefit on physical outcomes, but also on patient-related outcome measures such as respiratory symptom reduction and overall quality of life. A second limitation is the struggle to comply and complete in pulmonary rehabilitation programs, and again the potential miss out on the beneficial properties from pulmonary rehabilitation programs. So these struggles are struggles in Denmark as well, and we know from our clinical trial registries that around 50% of the patients are actually able to comply with our PR programs in Denmark. So it's a devastatingly low compliance rate we have in Denmark, but actually in accordance with also the existing evidence on the global perspective. And this is issues and areas that has been widely and extended investigated, and what we know are the major reasons are transport issues and inconvenience in terms of daily interruptions when you participate in pulmonary rehabilitation programs, but also the daily fluctuations of respiratory symptoms makes it difficult for patients to come into the hospital and participate in our pulmonary rehabilitation programs. Well, from my point of view, I don't think we are there yet where we can say that pulmonary rehabilitation is an equivalent intervention to conventional PR program at this point of time. I would wish, if you ask me the same question in 3 or 5 years' time, we would have enough supportive evidence to suggest that it was equivalent or a secondary choice for conventional PR programs. But we still need a lot more research and also research using realistic delivery models for the tele-rehab program. But based on the current evidence and from a clinical perspective at least, I think tele-rehabilitation could potentially be a secondary alternative for those patients that we know who are not able to comply to the conventional PR programs in terms of just creating more access for those who are not able to participate in the conventional programs. And I think those who would be most suitable for this secondary alternative would be those patients who have a history of non-compliance to previous conventional PR programs, but it could also be those patients who live in rural districts who have like 150 kilometers to a conventional program and thereby really poor access. So that could be a way to start out. It could even be patients who are still on labor markets and working, who needs a tele-rehab connection to the hospital and still be able to take care of their jobs. From the existing randomized control trials delivering pulmonary tele-rehabilitation, it does appear to be equivalent to a conventional PR program. The problem with the published studies are that when you go through the trial registries, it's pretty unclear whether they were predefined as superior or equivalent or non-inferior trials, and thereby from an academic perspective, we're not able to make firm conclusions. We need more equivalence and non-inferior designs. But it does appear to have similar effects, and it does appear to have the same safety as conventional PR programs, so there are potentials.